Welcome. We're back from recess. We are now on our last item on the agenda, which is Bill 269-37, introduced by Senator Sabina Flores Perez. It's an act to add a new Article 2 to Chapter 53, Title 10 Guam Code Annotated, relative to standardizing labeling and testing of bottled water. So I'd like to make some opening remarks and then open up the floor to testimony. So Bill 269-37 aims to standardize the labeling and testing of bottled water on Guam. This would apply to imported bottled water as well as water bottled domestically. The bill provides definitions and standards for labeling of bottled water that is aligned with the FDA regulations, including labeling for other types of bottled drink, which exempts other types of bottled drinks such as tea, sodas, and seltzers. Bill 269-37 seeks to mandate random testing of bottled water for regulated contaminants. The testing of water bottles is to be conducted by Guam EPA at least once annually for products subject to regulations from the FDA under the Federal Food, Drug, and Cosmetic Act. Additionally, Guam EPA is mandated to conduct at least 4 random tests annually for products not subject to FDA regulations under the Federal Food, Drug, and Cosmetic Act. Should the testing generate results not in line with U.S. EPA Safe Drinking Water Act, then Department of Public Health is responsible for issuing a recall of any lot of bottled water that has been tested and does not conform to U.S. EPA contaminant levels, or MCLs is what they're called. With the newly regulated contaminant of PFAS chemicals, also of dieldrin, which is a neurotoxin and carcinogen that was banned since the 1980s, but is found here on Guam, and particularly high in 3 wells, and other contaminants found in some of Guam Water Works wells, and the ubiquitousness of PFAS throughout the U.S., it is important that the water we drink, whether derived from the municipal water supply or bottled water, is safe to drink. I look forward to discussion and hopefully the support on this measure. At this time, we have, I would call upon those that signed up to testify, but we'll start with the agency. So I think either Julie or Nick Rupley, who's providing the testimony, you're recognized.
Hi, good afternoon, Senator Perez, Senator Brown. Our administrator, Michelle Lastimosa, sends her regrets for not being able to provide the testimony in person. I do have Ms. Juliana Mendoza with me. She's an environmental health specialist too, under the Safe Drinking Water program with Guam EPA. Upon review of Bill 269, Guam EPA finds that the legislation seeks to amend the Island's Safe Drinking Water Act, codified under 10 GCA Chapter 53, by adding a new article entitled Bottled Water. Under this new article, new definitions are added to provide meaning to the bill's intent to set bottled water labeling standards, exemptions, provisions for random testing of locally bottled water and potentially imported bottled water. At this time, Guam EPA urges the committee to reconsider the bill altogether so that we can have the opportunity to promulgate rules and regs for bottled water, which is granted under existing authority. And that authority states that we may promulgate separate rules and regulations for monitoring and other requirements specifically for bottled water companies and even water vending machines, respectively. Being afforded this consideration will provide the agency, the public stakeholders, and the community a chance to participate in the adjudication process for our rules and regulations when we're ready to propose them. So it's important that we make this as much as a public process as we can, so that proper evaluation of every potentially affected bottled water company and water vending machine will be performed, and that adherence to and proper application of the Federal Safe Drinking Water Act regulations by reference are applied to bottled water companies and water vending machines in terms of compliance, monitoring, sanitary surveys, operator certifications, and reporting requirements. Additionally, we want to ensure that economic feasibility, administrative, and scientific review can take place in this process so that nothing arbitrary will affect our mission to protect human and environmental health through the regulation of bottled water produced on Guam. The agency also notes that this is an unfunded mandate, as our compliance with the provisions contained in the bill will require additional staff to conduct the inspections as called out in the bill. Generally speaking, bottled water as a sealed commodity is regulated by the Food and Drug Administration. It is also the agency's understanding that public health may possess the local oversight and compliance and enforcement capabilities with respect to the FDA's FFDCA. We do recognize that certain local and federal authorities and regulations may overlap, duplicate efforts, or be open to significant interpretation if we are to address regulating under both the Safe Drinking Water Act and the Federal Food, Drug, and Cosmetic Act. For this reason, we understand that bottled water companies who supply potable drinking water as a consumable commodity must possess a sanitary permit issued by public health and adhere to sections in the Guam Food Code which describe water deriving from an approved source. I also want to add that with respect to bottled water and its safety, bottled water must be at least as stringent as EPA regulations which govern the tap water. So that's kind of our understanding in that process. We also want to point out that compliance with the Safe Drinking Water Act's provisions which address MCLs for regulated contaminants under the Act will require off-island analysis at an EPA and a Guam EPA certified laboratory because the island does not possess the laboratory capacity to perform the analysis of the over 90 contaminants that are listed under the National Primary Drinking Water Regulations. And this is going to be a costly endeavor. You could potentially look at somewhere in the neighborhood of $2,000 to $3,000, especially if you include analysis for PFAS. So it could present a costly proposition to public water system operators. And on the subject of the proposed definition of a public water system, we do recommend that the current definition listed in the current statute remains so that we can ensure federal compliance and consistency and avoid confusion in future regulations. So we're here for any other piece of information that you might need today. Thank you.
Thank you for your testimony. So at this time, I'd like to recognize Dr. Weir for his testimony.
Thank you, Senator Perez and Senator Brown. I have submitted some written testimony which has been in the Guam Post, and I also had forwarded this to Senator Brown in the past. As regards EPA's recommendations, I would recommend they be ignored. EPA has known about this problem for over a year and, to my knowledge, has done nothing except monitor it. Their position, as they have expressed it to me, is they have no regulatory authority at this point and therefore have no power to do anything. I think this bill is essential so that the people of Guam do know what is safe to drink and what isn't. As the Guam EPA has pointed out, a lot of this regulatory power rests with the FDA. And perhaps even with CDC. And I think that the legislature and the governor need to put pressure on these agencies to make known what the facts are for the people of Guam. Currently, we have basically an elephant in the room. GWA has continued to put out statements that their water is safe to drink, all the time knowing that it contains significant levels of carcinogens. This is unacceptable. We have to make this knowledge public. If you read through my written testimony, I have spent the past year trying to find some facts. And it's only in the last week or two, with the help of the governor's office and Senator Perez's office, that I have been able to get any facts, because I was told by GWA that they can't tell anybody anything about PFAS. And when I went to Guam EPA, and I've been there several times, I got the same story. They're happy to talk about dieldrin, but they're not happy to talk about PFAS. In the last week, that has changed. I have gotten some data from EPA, and we do have a problem. The problem is that nobody knows about it. And I don't see any, I would say, gumption on the part of EPA to make this public knowledge. As a physician who has been licensed and who has worked on Guam for the last 35 years, I think this is unacceptable. I'm happy to answer any questions.
Okay, thank you for your testimony, Dr. Weir. So yes, I do realize that when we passed Public Law 35-115, that was the Safe Drinking Water Act, that there was opportunities for developing regulations. And so some of them include bottled water companies, vending machines, water vending machines, and hauled water and rainwater catchment systems. And I think in my discussion, my last discussion with Brian, he was working closely with US EPA in regards to regaining primary authority, right, primacy for Safe Drinking Water Act. And also, I guess, there wasn't a follow-up discussion regarding the regulation. So what is your understanding about developing these regulations as far as the timeline? Do you have any collaboration with US EPA currently to assist with developing these regulations when it comes to these areas: bottled water, water vending machines, hauled water, rainwater catchment systems?
Hi, Senator. My name is Juliana Mendoza with the Guam EPA Safe Drinking Water Program, and I am the environmental health specialist too. Yes, I've developed a draft regulation for bottled water companies, water vending machines, and for hauler regulations. I do have it. In the regulations, we want to call this a sort of, I guess, a part 2, because the part 1 of it was we adopted by reference the federal regulations. So the part 2 would be the Guam public water regulations that will cover areas where, for bottled water companies, water vending machines, and water haulers. And there are other regulations that we want to include that is not covered under the federal. So it's basically a local regulation. So I have that draft. It's not the final draft, and I think we need to we need to get clarification from EPA. And for example, let's use one of the water bottling companies on island, let's say Culligan, that serves water at Payless stores, correct? So there's, what, 4 or 5 Payless stores here that they set up their filling station. Now we have to get confirmation, and do we treat this as a one public water system with these 5 systems installed? Or do we have to, under the public water system definition, are they considered one public water system? So if you have the 5 public waters, let's say we have the 5 vending machines under one company, is it right to say we treat it as one and then collect samples from each of those filling stations? Or do we treat each of that filling station or vending machine or water bottling company at Payless as one public water system, requiring them to test for all the parameters required under the Safe Drinking Water Regulation? So we have the regulations, we have the basis of the regulation and the requirements for bottled water companies on water vending machines and the hauler trucks. I can provide you a draft, just so you know where we're coming from and how best we can regulate these water bottle companies and vending machine and hauler trucks. Just so that it's, we want to make sure that there's no financial burden as well, but we can write in our regulation the monitoring requirements. Let's say they would require to do back tea on a monthly basis as required at each filling station. They can do the chemicals, which is the inorganics and the organics. Instead of doing the initial monitoring, we can require them to do it once every 3 years. And the reason for that is because their source is from GWA. They will be considered under the regulation as a consecutive connection system. So if GWA runs these tests, samples for all of these parameters, then it's safe to say that instead of going through the initial monitoring, just a save cost, that they can do reduced monitoring. But that will be spelled out and written out on this part 2 of the regulation, and we're going to call it the Guam Public Water System Regulation. That will be considered as the local regulation.
Thank you for that update. I didn't realize you moved this far with the regulations, so I'm glad to see that progress. In regards to finding your answer, whether this is a public water system or these individual units are individual public water systems or one whole, have you had a response from US EPA?
No, I haven't. This is something that I don't want to say has been pushed back, but because I saw the bill, it kind of prompted me to look at the draft again. And then just after thinking about it, we got to be careful. If we're going to classify each of this water bottle company and vending machine as a public water system, we're looking at 130. 130 public water systems. We just need to get clarification, and I will send an email to EPA first thing tomorrow morning if we're able to consolidate these water vending machines into one, if it's owned by one company. Otherwise, if it's not, then we will have to treat each water bottle company and vending machine as one public water system.
Yeah, I understand like GRMC has that, it's a consecutive water system, is that correct?
Correct. They are a public water system because not only that they purchase from GWA, but they have their own treatment in the facility. So that's why they are considered a public water system.
Okay. And then Culligan, I know there are 3 methods, general methods that are known to be approved by US EPA to treat PFAS, correct?
Correct.
Yeah, so Culligan, I know they're the reverse osmosis, is one, the granulated activated carbon,
Correct.
and then ion exchange. And
Correct.
so that would also fall under the guidelines of the Safe Drinking Water Act
Correct.
for that particular treatment. So,
Correct.
okay.
Yeah,
And
we would look at, we would conduct a sanitary survey. I think the first step is that to create these rules, and then, this will set up our plan to determine if they're a public water system. So we would visit these water bottling companies and vending machines, conduct a sanitary survey, make a determination, and then go back to these companies and say, if they are a public water system, this is what needs to get done.
in regards to bottled water, so bottled water that's imported from off-island, so this is one thing I've learned like in the past. I don't know if things have changed much, but I was told that municipal water supplies, the utility has to follow a more rigorous testing regimen than a bottled water company. What is your take on that information?
So, and I have to say that, under the drinking water, the regulation, if this regulation goes through, for example, and if you agree, we're going to go through this, but we stop at the filling station. So if these water bottling companies and vending machines are identified as a public water system, they have to follow the federal regulation that we adopted. Our jurisdiction will stop at the filling station. Anything after that, if it's once it's filled in the bottle, that should be public health. So it's only because we don't know if the bottle has been sanitized, that could potentially, contaminate the water. But in our draft regulation, as part of, let's say, the lead and copper sampling or the disinfection byproduct sampling, we would require one sample from a 5-gallon bottle that's been sitting there for 24 hours. That will be considered one of the sampling location. But anything after the filling station, we do not have jurisdiction. We want to ensure that the water that is being distributed is safe and potable.
Okay, so maybe this question's for Nick. So in your testimony, you were mentioning that bottled water that's sold and imported into Guam, also has to comply with the U.S. EPA Safe Drinking Water Act. Is that accurate? And to what extent do they do the testing on their bottled water?
That's difficult to answer because you'd first have to identify the source of the water at the bottling manufacturing plant. Sometimes it could come from a spring, their own well, or even the facility's taps, and that, without physically visiting the manufacturing plant to observe the process, you're really not going to know. But the Safe Drinking Water Act is rather specific on the treatment of your ground and your surface water, and if that makes its way into a sealed bottle for purchase as a consumable commodity, it's our understanding that regulation then changes hands with the FDA. But then the FDA will loop back and say the water quality standards for that product must be at least as stringent as US EPA's provisions for tap water.
Yeah, that's another problem, right? So if the water tests okay, but then now the bottle itself is contaminated, that's going to definitely, it's a source of contamination. So I think it needs to be tested in its complete packaging when it's completely packaged. So I don't know to what extent maybe Guam EPA can require these companies to have a certification of some sort that they were tested
Right.
at certain
I
frequency.
think definitely going to have some collaboration with Public Health's Division of Environmental Health on this, especially when we're closer to finalizing rules and regulations for this type of operation. And until we get our clarification from our partners over at Region 9 about classification of certain systems, you know, we're not ready to move with collaborating with the DEH yet, but it's something that we will need to do because of their oversight on commodities that are regulated under the FFDCA.
So what would be your timeline to get these regulations out for the public to view and provide feedback so that we can get the promulgation process moving?
So right now we do have the final. I just need to get clarification from EPA, and if it's approved to consolidate these water vending machines as one owned by one water bottling company, then I just need to do some revision. It's already all laid out. We just have to wait for that confirmation.
Okay, thank you for your response. Dr. Weir, yes, you had some comments regarding the questions I had earlier.
My understanding is that bottled water has been given by the EPA to the FDA for, they're the ones that monitor this. So that's why I mentioned earlier, I think it's very important that we put as much pressure on FDA to let us know what's going on here as we can. Again, it's fine to regulate our local water producers, but our local water producers all get their water, or nearly all of them, get their water from GWA. They run it in, they filter it, and they put it out, and to my knowledge, none of them use systems which are aimed at chemicals. They're aimed at bacteria primarily. And so to promulgate regulations which basically affect them and don't affect GWA, I don't think that's fair. And for everyone else that drinks the water out of the faucet, as GWA recommends, it's definitely not fair.
Sorry, if you can clarify, because the Safe Drinking Water Act does regulate GWA. So can you clarify where the unfairness is in that?
If they're putting clean water into their system, I think we can be assumed that probably what's coming out is going to be fair, and to subject them to the same regulations that GWA should be adhering to, I don't think is reasonable. I think that's unnecessary testing. I think it's reasonable to test them on occasion. I'm not, prepared to say what that occasion is, but I think that the root cause of the problem at this point is GWA. And this is a huge problem. We're not just talking about bottled water. In looking at this, I was relieved to find out that over the last 2 years or more, our local bottling companies, foremost with Coca-Cola and Calvo's with Pepsi, have ceased bottling those beverages on island, and they import them. That's good, as long as they've been tested. But Calvo's continues to put out 5-gallon bottled water, And, you know, operations like those that deal with Culligan and rainwater and other operations, these have, you're talking 60, 80, 100 different water stations on this island. And basically, this proposal is going to put most of those out of business. Not because they're not attempting to do what they should be doing, but because they're relying on GWA. And so we need to get to the root of the problem.
Yeah, so we did have oversight hearings in regards to that, and GWA did testify that they have designed a treatment plan. They have a treatment plan in place. So yeah, that definitely is in the works. And in regards to bottled water, though, so what is your recommendation for bottled water?
My recommendation is that any water that anybody drinks on Guam, they should be able to find out what the level of contamination is. And that includes GWA, it includes any water supplies that are imported into the island. We need to keep in mind that if you go down to any of the fast food places and order a soda, that soda comes out of a machine that uses GWA water. They don't, most of them do not hand you a bottle of bottled water, bottled soda from somewhere else. They have a machine that puts the ingredients in and you have your water there. I mean, your soda there, and basically it's public water supply. This problem goes a lot farther than just water, too, because we also have a waste treatment plant that does nothing with their effluent as regards chemicals. Our main plant here is just down the road, and we have no idea what's happening to fish and other wildlife at this point in terms of contamination. We have a big problem. And at this point, I don't hear anyone talking about it. And I'm very happy to see that we at least are making a start here.
Dr. Weir, I just wanted to get clarification. Are you in support of the bill, or do you seek
I'm very much in support of having testing so that people know what water is not contaminated and what water is. And to do that, all of the water producers on Guam need to be forthcoming about what their product, where it comes from, and what the levels of contamination are. And at this point, getting that information is like pulling teeth. And I have used Freedom of Information requests from GWA. Their response has been, this is a national security issue. We can't tell you anything about it. We have a ongoing lawsuit. We can't tell you anything about it. We won't even talk to you about it. Literally, I went into the director's office and that was what I was told. I was told similar things by EPA 3 weeks ago.
Yeah.
Not talking about it is not acceptable.
Yeah, I'm sorry you had that treatment, but we have this discussion on the floor, so you have made definitely some. You had an effect for sure, and I know your advocacy is important for our community. I too, and I think EPA as well is also, you know, we are all stakeholders here. And, you know, I hope to get the regulations out soon. So, yeah, thank you for your work on that. The other questions I just wanted to confirm, Dr. Weir.
Again, I think that it needs to be recognized that EPA doesn't have jurisdiction here for bottled water. That
Yes,
jurisdiction resides with FDA.
Correct, correct.
And until we put some pressure on FDA, we're going to continue to go along the way we are now. Nobody's going to know anything about what the dangers are or are not. And, you know, in case you think that this is not a big problem, I urge you to look at the National EPA site and read about these chemicals. I can also tell you from my research here on Guam, I went to UOG, looked at their statistics for cancers in the various villages in Guam. The highest area of cancer on Guam is right here in Agana, and it's considerably higher than any other village on Guam. Here in Guam is where the most contaminated wells have known to have been present for at least 5 years when the article came out in the Post that I read about at that time. So this is not, you know, this is not a new problem.
Yeah, I share your you know, sentiments. I think it's sad that we've been exposed to a lot of these chemicals, and partly because they're considered as emerging contaminants, so they weren't regulated until recently. And we, you know, we probably all grew up with drinking this water if you were living at this time, you know, from, you know, at such a young age. And it's, I think, something that we need to really push for is the precautionary principle, right? Before a chemical ever gets used, they have to prove its safety, versus it being used and then finding out decades later that it's causing your illness today. And I think this is something we need to transition to a safer community. So yeah, I appreciate your advocacy. At this time, I'd like to open the floor to my colleague, Senator Brown. If you have any questions or comments.
Thank you very much, Madam Chair. I certainly appreciate the dialogue with regards to this issue, and I think the challenge is here because we would like to, I guess the proposal here is to put the testing under Guam EPA, but you know, bottled water has never been the jurisdiction of Guam EPA. I mean, the agency's already challenged with addressing everything else outside of bottled water, and you know, food-related items all fall under public health. And I've always had the question since my time at Guam EPA, and that's been 30+ years, is who's testing the drinking water, the bottled drinking water? I know we're all under the impression that if we're drinking bottled water, that somehow it's of better quality, and even I don't know that, because I don't know if public health has, in any regular way, tested the bottled water that we are consuming. And we spend many, many times over to buy bottled water, and I do as well now. I used to always drink GWA water and think that I was going, okay, I'm going to try bottled water. But even I don't know if all the money we're spending on bottled water, in some cases, bottled water can cost you as much as soda and other things you may want to buy, and it's just water. So I understand the challenge Guam EPA is going on. If there's any expectation now that we're going to start having Guam EPA fall under the jurisdiction of what is under the responsibility of public health, I think their resources are going to be far too stretched. I mean, they're already addressing the testing of the water system that we have now with GWA, plus also our coastal water, our river waters that they're also required to test to determine what the water quality is. And we don't have a key partner here. We don't have public health here providing testimony. And I think, Madam Chair, before we move forward, it'd be good to have another hearing or roundtable, bring public health in here so we can ask these questions of them. With regards to what type of testing have they been doing at all, with regards to the, you know, the various, I mean, now there's so many brands of water. You know, I even see Fiji water. I used to go into bookstores in San Francisco and you'd see Fiji water for sale, and I'm thinking, I've been to Fiji several times. The quality of drinking water in life for the majority of the people there, you know, are not upscale at all by any means. But we drink Fiji water and we pay how much more for it because we think it's the best water and it's better for us. So I think that's a challenge that we have to deal with, but I think that needs to be further addressed. We can mandate all we want, but if the resources are not there to do it and execute it, and more importantly, the jurisdiction, because I think this is already kind of blending into a separate area. I think public health needs to be held responsible for their jurisdiction. I know we're challenged even to see if restaurants are being properly inspected on a regular basis, to know if the food that we're consuming at the restaurants is being properly prepared, or, you know, most recently to find out last year that our school system, that we're getting, you know, these ratings of performance, only to find out that no inspections were being done at all by public health, and yet they were giving out, you know, these certificates that no inspections occurred with. So I just think there's going to need to be more discussion with regards to this issue. And I appreciate, Dr. Weir, your engagement with your expertise in providing the information and doing the effort that you have to continue to promote and bring this issue to light. You know, as our chairwoman had said, this whole issue of PFAS is really a recent adventure with regards to regulation. And what do we do with it? I mean, the reality is also, we're talking earlier about the land tax. Well, let's talk about increased cost on your water bill. I mean, we just had a hearing not too long ago with the Guam Waterworks Authority of asking, through legislation, authorization to borrow up to $800 million that the ratepayers of Guam are going to be paying for, so that they can meet the new mandated requirements, federal requirements, with regards to water quality to address PFAS. That's going to be a major undertaking, a major cost to the people of Guam. And you know, as we were discussing where these contaminants are coming from, and they talked about how we had, you know, fire foam, and this is coming from fire foam, and they've since changed the standards for fire foam, but it's going to cost the people of Guam millions and millions and millions of dollars to properly treat and remove this element from our drinking water. So we are challenged. I mean, water quality is a very important issue. We all want to know that what we're drinking is safe. We all want to know certainly what our children, our families drinking is safe. But I've never had that comfort in 30 plus years of knowing that our drinking water is safe. Not just what we're getting from the Guam Waterworks Authority, but more importantly, because we are paying so much more for a gallon of or even less than that, how many ounces of bottled water, and yet we have no idea. I don't care if it comes from France or wherever it is. We have no idea what water quality testing is going in to that water. So I'd recommend, because I think this is a broader issue than where we are today, this afternoon, with regards to just this testimonies that we have from the public that are here today. But I think public health needs to be brought to the table so that we can find out, Madam Chair, what testing have they been doing, if they've been doing any testing at all, and what are they putting in place to address this emerging issue of this additional chemicals that we need to actually not just regulate, but essentially filtrate out of our water at the water wells. So that's my comments. I don't have any questions. I've heard already and appreciate the testimony that all of you have provided with regards to this issue, but I think there's a broader scale here we need to send out and have public health come in and provide testimony, because legally the issue of bottled water testing is under their jurisdiction. Thank you. Thank you for the opportunity to comment.
Sitozmasi, Senator Brown. Yes, I do share those sentiments that, you know, our water is so important to our health and our community. I know growing up in Guam, you know, I've always wondered about the safety of our water, especially, you know, we have a military base on top of our aquifer. And, you know, my parents actually bought bottled water at the time because they were unsure of the safety of the drinking water. So I think, too, you know, part of the issue is we don't rely on the precautionary principle. We're producing thousands upon thousands of chemicals without knowing the true impact to our health. And until we get to that point, I think we can then maybe start really being assured that our drinking water is safe, our environment is safe. You know, we're here in this buildup, right, military buildup. We're exposed to a lot of contamination from open detonation, legacy contamination. And so these are issues that we as a community are facing. And just the ubiquitousness of PFAS, I mean, it's been used widely. It's almost everywhere. And so it's a concern not only for the resource, our water resource that's derived from here, but also from water everywhere in the country and throughout the world. you know, I'm almost afraid to see what the PFAS levels, but maybe it's important that we know that what we're drinking is safe, whether it's utility derived or whether it's bottled. And so I think, yeah, we definitely need to reach out to Department of Environmental Health and Department of Public Health and Social Services, also to maybe look at a potential way of these companies that we're importing water from is, you know, has truly tested and certified their source of water. I think that's really critical. One thing I can add, though, is that, you know, even if we certify the water as being safe, all these instruments that are in contact with the water can add a contaminant to it, whether it be PFAS or lead, and other things. So I was also involved in this study where we tested a lot of the coffee, you know, baristas, and then we tested them and we found that certain products had lead, and so that's important to think about as we're developing these regulations. I know regulations, they tend to be stepwise. We develop them, you know, in a stepwise fashion, but I think these little steps that we make in the long run can definitely help create more of a holistic approach to ensuring that our water is safe, because that is really the route in which we're going to be exposed to contaminants mostly is from our drinking water at this point, I think. And until we can ban PFAS and its family of chemicals that probably have similar impacts, you know, we need to start, you know, mitigating it and filtering it. You know, ultimately, I would like to see that it's mitigated in our environment. Once we get rid of the source, there's less pressure to have to filtrate and treat it. You know, let's get rid of the source of the PFAS. I think that's really important. Like you said, Dr. Weir, let's get to the root of the problem. So thank you for being here, and I hope to see more progress on the regulations, and look forward to the public notice for input. So thank you for your attendance today. If there are no further questions or comments, we will continue to receive testimony until 4 p.m. May 14th. Please address all testimony to Senator Sabina Flores Perez, Chairperson of the Committee on Environment, Revenue and Taxation, Labor, Procurement, Statistics, Research, or Planning. It can be dropped off in the mailboxes here at the Guam Congress Building or emailed to office@senatorperez.org. Siduos Masi, we are now adjourning. At the time, it's 5:37 p.m. Have a great evening.